talk is on the clinical evaluation of a CRISPR-based rhythmic assay for the diagnosis of fungal endophthalmitis. These are my financial disclosures. So despite affecting more than 1 billion people and causing more than 1.5 million deaths annually, fungal infections remain a pernicious neglect. This is best exemplified by the high rate of misdiagnosis of fungal infections in different organ systems. Hence, there's a huge unmet need to improve fungal diagnostics. Fungal endophthalmitis in a way epitomizes this diagnostic challenge. In our country, 20 to 30% are only of endophthalmitis are culture positive, among which fungi are seen in 11 to 22% of the patients. But interestingly, among these 80% who are culture negative, recent NGS data suggests that 65% could actually be fungal. So our aim was to develop a rapid, accurate, cost-effective test to diagnose fungal infections using CRISPR. We have termed this as rhythmic, which stands for rapid identification of mycosis using CRISPR. So initially we developed this assay and clinically validated it in fungal keratitis. This was important because for fungal keratitis there is a robust gold standard, which is culture and microscopy. And in fungal keratitis, the sensitivity was 93% and specificity was 89%, far outperforming pan-fungal PCR. So this is the principle of the assay. There is an isothermal amplification step which amplifies the target fungal DNA is present. This is followed by the CRISPR reaction. The important thing is all of this happens at isothermal 37 degrees Celsius. So there's no need of any sophisticated thermocycler for this assay. So how did we interpret this assay? So we have two readouts. One is a binary qualitative readout which gives us a yes or no answer, and this is useful for point of care testings. And we also included a real-time readout which will help us predict fungal loads in tertiary facilities. So a test was this, for the real-time readout, a test was considered positive. It was beyond this threshold, which was mean plus 3 times the standard deviation of the RFU obtained from 10 healthy donors. And for the binary readout, these photographs of these sample tubes were shared with 3 independent observers who graded them as positive or negative depending on the color they were seeing, and they were blinded to the results of other microbiology investigations. So in this study, 118 patients were included and 133 samples from these patients were included in this study. So using culture as the gold standard, 2 patients were culture positive and both were positive by the rhythmic assay also. So the sensitivity was 100%, but there were 21 samples which were positive by rhythmic but not by culture. So following this, we did a pan-fungal PCR, compared it with pan-fungal PCR. The sensitivity was 88% and the specificity was 93%. However, there were still 10 samples which were discordant. The 10 were positive only by the rhythmic assay and not by PCR, while 2 were positive only by the PCR and not by rhythmic. So following this, we did a discrepancy analysis. A multidisciplinary team looked at the clinical records of these patients. So among the 8 patients who were rhythmic positive but pan-fungal PCR negative, 5 had received antifungal therapy, among which 4 had shown both functional and anatomical success and were reclassified as true positives. So after this discrepancy analysis, the sensitivity was 90.5% and the specificity was 96.5% for the rhythmic assay. So why is this assay more specific than PCR? In PCR, the specificity is driven by the specificity of the 2 primers. So in this rhythmic assay, in addition to the specificity of these 2 primers, there is an additional CRISPR RNA. So this makes sure that there is less off-target amplification and makes it more specific than PCR. The other thing is, since the rhythmic assay is more sensitive because both vitreous and aqueous have the presence of PCR inhibitors intrinsically. So to study this, we took Aspergillus DNA and Candida DNA and seeded them in nucleus-free water, aqueous humor and vitreous humor, and did both pan-fungal PCR and rhythmic. So a green indicates a positive result by rhythmic, while a band indicates a positive result by pan-fungal PCR. In nucleus-free water, there is no difference in the sensitivity between the 2 assays, but in aqueous and vitreous humor, there is a significant decrease in the sensitivity of PCR, which was not seen in rhythmic assay. So this shows that the rhythmic assay is more sensitive and specific than PCR. So what is the clinical relevance of this enhanced sensitivity? So this is a patient with bilateral endophthalmitis. So aqueous humor and vitreous humor were collected from both the eyes. So culture was negative in all the 4. PCR, eubacterial PCR was negative in all the 4. Pan-fungal PCR was only positive in the one sample. So this does not help in clinical treatment because only 1 out of the 4, considering that the same disease has affected both the eyes. But when we did rhythmic, all the 4 were positive for fungus. So this is the most important data. We retrospectively analyzed what happened to these patients who were CRISPR positive. So among the patients who received antifungal, 7 out of 8 showed anatomical success, none had phthisis. But among the patients who did not receive antifungal, 4 went into phthisis. So all this work has resulted that rhythmic today is the standard of care in our institution. This is a sample report we have generated. So now it is in TRR level 6, and we aim to convert this assay into a kit soon, hopefully, so that this will be commercially available to everyone. So to conclude, this is the first CRISPR-based system for the diagnosis of fungal infections in any organ system. The sensitivity and specificity is better than pan-fungal PCR. The turnaround time is between 60 to 120 minutes. Thank you.
So you did this rhythmic for both aqueous and vitreous.
Yes.
So which is the preferred sample? So for fungal endophthalmitis, would you do a vitreous sample or aqueous sample is
So
enough?
depending on where we suspect the nidus to be, madam. If it is a keratitis associated endophthalmitis, then aqueous would be more durable. But in what we have seen is, if the nidus is considered to be in post-operative cases, aqueous is better, madam. But in endogenous cases, we find the vitreous to give more yield.
Okay, thank you so much,